Thyroid disease, causes, symptoms, risk factors, testing and treatment. The thyroid gland is a small organ that's located in the front of the neck, wrapped around the windpipe, trachea. Your thyroid makes hormones that help control many vital functions of your body. If your body makes too much thyroid hormone, you can develop a condition called hyperthyroidism. If your body makes too little thyroid hormone, it's called hypothyroidism. Both conditions are serious and need to be treated by your healthcare provider. Your thyroid has an important job to do within your body, releasing and controlling thyroid hormones that control metabolism. The thyroid controls your metabolism with a few specific hormones. T4, thyroxine, contains 4 iodide atoms, and T3, triiodothyronine, contains 3 iodide atoms. These 2 hormones are created by the thyroid and they tell the body's cells how much energy to use. When the pituitary gland senses a lack of thyroid hormones or a high level of hormones in your body, it will adjust the amounts with its own hormone. The TSH will be sent to the thyroid and it will tell the thyroid what needs to be done to get the body back to normal. Thyroid disease is a general term for a medical condition that keeps your thyroid from making the right amount of hormones. When the thyroid makes too much thyroid hormone, your body uses energy too quickly. Using energy too quickly will do more than make you tired. It can make your heart beat faster, cause you to lose weight without trying, and even make you feel nervous. On the flip side of this, your thyroid can make too little thyroid hormone. When you have too little thyroid hormone in your body, it can make you feel tired, you might gain weight, and you may even be unable to tolerate cold temperatures. These 2 main disorders can be caused by a variety of conditions. Thyroid disease is very common, with an estimated 20 million people in the United States having some type of thyroid disorder. A woman is about 5 to 8 times more likely to be diagnosed with a thyroid condition than a man. Have a medical condition. These can include pernicious anemia, type 1 diabetes, primary adrenal insufficiency, lupus, rheumatoid arthritis, Sjogren's syndrome and Turner syndrome. Both conditions can be caused by other diseases that impact the way the thyroid gland works. Conditions that can cause hypothyroidism include thyroiditis. This condition is an inflammation, swelling, of the thyroid gland. Thyroiditis can lower the amount of hormones your thyroid produces. This condition is an inflammation, swelling, of the thyroid gland. Thyroiditis can lower the amount of hormones your thyroid produces. Hashimoto's thyroiditis, a painless disease. Hashimoto's thyroiditis is an autoimmune condition where the body's cells attack and damage the thyroid. A painless disease. Hashimoto's thyroiditis is an autoimmune condition where the body's cells attack and damage the thyroid. Iodine deficiency. Iodine is used by the thyroid to produce hormones. Iodine is used by the thyroid to produce hormones. All newborns are given a screening blood test in the hospital to check their thyroid function. Conditions that can cause hyperthyroidism include Graves' disease. In this condition, the entire thyroid gland might be overactive and produce too much hormone. This problem is also called diffuse toxic goiter, enlarged thyroid gland. Thyroid blood tests are used to see if you have hyperthyroidism. Thyroid blood tests are used to diagnose thyroid disorders associated with hyper or hypothyroidism. The specific blood tests that will be done to test your thyroid can include thyroid stimulating hormone, TSH, is produced in the pituitary gland and regulates the balance of thyroid hormones, including T4 and T3, in the bloodstream. Is produced in the pituitary gland and regulates the balance of thyroid hormones, including T4 and T3, in the bloodstream. This is usually the first test your provider will do to check for thyroid hormone imbalance. Most of the time, thyroid hormone deficiency, hypothyroidism, is associated with an elevated TSH level, while thyroid hormone excess, hyperthyroidism, is associated with a low TSH level. T4, thyroxine tests for hypothyroidism and hyperthyroidism, and used to monitor treatment of thyroid disorders. Tests for hypothyroidism and hyperthyroidism, and used to monitor treatment of thyroid disorders. Low T3 levels can be observed in hypothyroidism, but more often this test is useful in the diagnosis and management of hyperthyroidism, where T3 levels are elevated. Tests help diagnose hyperthyroidism or to show the severity of hyperthyroidism. These tests help identify different types of autoimmune thyroid conditions. Calcitonin. This test is used to diagnose C-cell hyperplasia and medullary thyroid cancer, both of which are rare thyroid disorders. This test is used to diagnose C-cell hyperplasia and medullary thyroid cancer, both of which are rare thyroid disorders. Beta blockers. These medications don't change the amount of hormones in your body, but they help control your symptoms. Surgery, a more permanent form of treatment. Your healthcare provider may surgically remove your thyroid, thyroidectomy. If you have low levels of thyroid hormones, hypothyroidism, the main treatment option is thyroid replacement medication. This drug is a synthetic, man-made, way to add thyroid hormones back into your body. Alternatively, there is a version of the thyroid removal surgery where your surgeon makes an incision in your armpit and then creates a tunnel to your thyroid. This is most likely in situations where you have a nodule that's causing your thyroid problem.